Medical Assistant Exam Final Review. Question 1. At the start of care in a same-day appointment, the endocrine system is being reviewed. Which gland produces thyroid hormone? Option A, appendix. Option B, urinary bladder. Option C, gallbladder. Option D, thyroid gland. The correct answer is option D, thyroid gland. The thyroid gland produces hormones that help regulate metabolism. The appendix does not produce thyroid hormone. The urinary bladder stores urine and does not produce thyroid hormone. The gallbladder stores bile and is not an endocrine gland producing thyroid hormone. Question 2. During a treatment room, the assistant reviews the normal pacemaker of the heart. Which structure is identified? Option A, alveolus. Option B, gallbladder. Option C, sinoatrial node. Option D, ureter. The correct answer is option C, sinoatrial node. The sinoatrial node normally initiates the heart's electrical impulse. An alveolus is a lung air sac. The gallbladder stores bile and is not cardiac conduction tissue. A ureter carries urine from kidney to bladder. Question 3. The care team in an administrative check-in area asks for guidance because a patient feels faint during a blood draw. Which response should occur first? Option A, tell the patient to stand up quickly. Option B, finish filling the tube before responding. Option C, stop the procedure and protect the patient from injury. Option D, leave the patient alone to find paperwork. The correct answer is option C, stop the procedure and protect the patient from injury. Safety comes first when a patient shows signs of syncope during venipuncture. Standing can worsen faintness and lead to a fall. Continuing the draw can worsen the situation and increase injury risk. A faint patient should not be left unattended. Question 4. At the start of care in a family practice clinic, a patient is scheduled for an electrocardiogram and asks whether it will shock them. Which response is accurate? Option A. The machine draws blood through the wires. Option B. The electrodes inject medication. Option C. The test shocks every patient to start the heart. Option D. The test records electrical activity and does not deliver a shock. The correct answer is option D. The test records electrical activity and does not deliver a shock. A standard electrocardiogram is a recording test, not a treatment shock. Electrocardiogram leads do not collect blood. Electrodes record signals and do not inject medication. A standard electrocardiogram does not deliver electrical therapy. Question 5. The care team in a diagnostic testing area asks for guidance because a small fire starts in a trash can at the clinic. Which acronym guides the initial fire response? Option A, RACE. Option B, NPO. Option C, SOAP. Option D, PRN. The correct answer is option A, RACE. RACE stands for Rescue, Alarm, Contain, and Extinguish or Evacuate depending on policy. NPO means nothing by mouth and is unrelated to fire safety. SOAP is a documentation format and does not guide fire response. PRN means is needed and does not guide emergency fire response. Question 6. Given the workflow in a same-day appointment, office supplies are consistently running out before the next order date. Which administrative action is best? Option A, wait until every item is completely gone. Option B, hide supplies from the provider. Option C, track usage and adjust par levels according to office needs. Option D, order random supplies without reviewing use. The correct answer is option C, track usage and adjust par levels according to office needs. Inventory control uses usage patterns and reorder points to prevent shortages. Waiting can interrupt patient care and office workflow. Hiding supplies does not solve inventory management. Unplanned ordering can waste money and storage space. Question 7. After reviewing the situation in a treatment room, a pain score is being collected during intake. Which approach is best? Option A, assume pain level from facial expression only. Option B, ask the patient to rate pain using the office's standard scale. Option C, tell the patient pain is not part of vital signs. Option D, change the score to match the assistant's opinion. The correct answer is option B, ask the patient to rate pain using the office's standard scale. Using a consistent pain scale helps document subjective pain in a comparable way. Facial expression alone may not reflect the patient's reported pain. Pain assessment is commonly included in intake workflows. The pain score should reflect the patient's report. Question 8. In a pediatric clinic, a medical assistant leaves a computer screen open with patient information visible. Which safeguard would help prevent this issue? Option A. Disable audit trails to speed workflow. Option B. Share passwords with trusted co-workers. Option C. Lock the workstation before stepping away. Option D. Keep the screen facing the waiting room. The correct answer is option C. Lock the workstation before stepping away. Locking the workstation protects electronic protected health information from unauthorized viewing. Audit trails support security monitoring and should not be disabled by staff. Shared passwords weaken accountability and violate security practices. Visible screens increase privacy risk. Question 9. When a patient encounter unfolds in a specialty referral visit, the provider is running behind and a patient asks for an update. Which response is professional? Option A. Tell the patient that waiting is their only option. Option B. Guarantee an exact time even when it is unknown. Option C. Apologize for the delay and provide the best available estimate. Option D. Discuss another patient's emergency as the reason. The correct answer is option C. Apologize for the delay and provide the best available estimate. Clear and courteous updates help manage expectations without blaming others. Dismissive communication is unprofessional. False certainty can create more frustration. Sharing another patient's situation can violate privacy. Question 10. While working in a community health clinic, a pulse oximeter is placed on a cold finger and the reading is inconsistent. Which action should be tried first? Option A. Place the probe over wet nail polish. Option B. Ignore the waveform and record the lowest value. Option C. Increase oxygen without reporting the finding. Option D. Warm the finger or choose a better perfused site. The correct answer is option D. Warm the finger or choose a better perfused site. Poor peripheral perfusion can make pulse oximetry readings unreliable. Moisture and polish can interfere with sensor performance. An unstable signal should be corrected before documenting the value. Medication or oxygen changes should follow provider direction and clinical protocol. Question 11. To protect safety in a cardiology practice, a coworker asks to view a neighbor's chart out of curiosity. Which response is appropriate? Option A. Open the chart if the coworker promises not to tell anyone. Option B. Share the chart because staff work in the same clinic. Option C. Print the chart and remove the patient's name only. Option D. Deny the request because there is no job-related need to know. The correct answer is option D. Deny the request because there is no job-related need to know. Access to protected health information must be limited to legitimate work-related purposes. A promise does not create a permitted reason for access. Employment at the same clinic does not automatically authorize chart access. De-identified information must meet specific standards and curiosity is not permitted access. Question 12. In a phlebotomy station, a provider needs the head of the exam table raised for a patient with breathing difficulty. Which position may be helpful? Option A. Fowler position. Option B. Lithotomy position. Option C. Trendelenburg as the only routine choice. Option D. Prone position. The correct answer is option A. Fowler position. Fowler position raises the head and upper body, which can ease breathing for some patients. Lithotomy is used for pelvic procedures and does not primarily support breathing. Trendelenburg lowers the head and is not the usual comfort position for breathing difficulty. Prone places the patient face down and may worsen breathing comfort. Question 13. After reviewing the situation in a preventive care visit, the prefix hyper appears in a term such as hyperglycemia. Which meaning is correct? Option A. Below normal. Option B. Between. Option C. Above normal or excessive. Option D. Around. The correct answer is option C. Above normal or excessive. Hyper means excessive or above normal, as in high blood glucose. Below normal is indicated by hypo. Between is indicated by inter. Around is indicated by peri. Question 14. In a family practice clinic, a patient arrives for a routine visit and appears anxious about the first blood pressure reading. Which communication technique should the medical assistant use? Option A. Ignore the anxiety to avoid making it worse. Option B. Tell the patient the reading is probably wrong. Option C. Promise that the provider will not be concerned. Option D. Acknowledge the concern and explain the procedure in simple terms. The correct answer is option D. Acknowledge the concern and explain the procedure in simple terms. Acknowledging emotion and explaining the task supports trust while keeping the patient informed. Ignoring patient concerns can increase anxiety and weaken communication. Dismissing the result can reduce confidence and may be clinically misleading. Promising an outcome goes beyond the assistant role and may be inaccurate. Question 15. To protect safety in a diagnostic testing area, the office wants to place 2 short follow-up visits in the same time slot according to policy. Which scheduling method is being used? Option A, double booking. Option B, wave scheduling. Option C, clustering. Option D, open hours. The correct answer is option A, double booking. Double booking places more than one patient in the same appointment slot. Wave scheduling schedules several patients to arrive at the beginning of a block. Clustering groups similar types of appointments together. Open hours allow patients to arrive without exact appointment times. Question 16. While working in a busy front office, a 24-hour urine collection begins at 8 a.m. Which instruction is correct? Option A, keep only the first void and discard the rest. Option B, discard the first void and collect all urine for the next 24 hours. Option C, leave the container unrefrigerated unless it smells unusual. Option D, collect urine only when symptoms occur. The correct answer is option B. Discard the first void and collect all urine for the next 24 hours. Discarding the first void establishes the start time, and all urine afterward is collected until the end time. A single first void is not a 24-hour collection. Storage requirements should follow the test protocol and preservative instructions. Timed urine testing requires all urine during the collection period. Question 17. When a patient encounter unfolds in an exam room, a patient needs assistance transferring from a wheelchair to the exam table. Which action is safest? Option A, pull the patient by the arms quickly. Option B, ask the patient to jump to the table. Option C, lock the wheelchair and use proper body mechanics with assistance as needed. Option D, leave the wheelchair unlocked for easier movement. The correct answer is option C. Lock the wheelchair and use proper body mechanics with assistance as needed. Locking equipment and using safe transfer technique reduces injury risk for the patient and staff. Pulling can injure the patient and the assistant. Jumping is unsafe and unrealistic for a transfer. An unlocked wheelchair can roll and cause a fall. Question 18. An office review in a patient education session shows that a patient states that the listed pharmacy is no longer used. Which action best supports accurate care coordination? Option A, update the preferred pharmacy after verifying the new information. Option B, choose the pharmacy closest to the clinic. Option C, delete all pharmacy information from the record. Option D, leave the old pharmacy because it is already in the chart. The correct answer is option A. Update the preferred pharmacy after verifying the new information. Current pharmacy information helps prescriptions and refills reach the correct location. The preferred pharmacy should come from the patient rather than staff convenience. Removing needed information can interrupt prescribing workflows. Outdated demographic information can delay medication access. Question 19. Before the visit continues in a same-day appointment, a patient says they feel chest pressure while the electrocardiogram is being prepared. Which action should the medical assistant take? Option A, notify the provider immediately and follow emergency protocol. Option B, complete all paperwork before telling anyone. Option C, tell the patient it is probably anxiety. Option D, ask the patient to drive to another clinic. The correct answer is option A. Notify the provider immediately and follow emergency protocol. Chest pressure may indicate a serious condition and requires prompt clinical attention. Administrative tasks should not delay reporting possible cardiac symptoms. Medical assistants should not diagnose the cause of chest pressure. Potential cardiac symptoms should be handled through established emergency procedures. Question 20. While working in an exam room, a used needle must be discarded after an injection. Which practice is safest? Option A, carry the needle to the front desk for disposal. Option B, place the needle in regular trash. Option C, recap the needle with both hands. Option D, activate the safety device and place the needle in a sharps container. The correct answer is option D. Activate the safety device and place the needle in a sharps container. Sharps should be secured and discarded immediately in a puncture-resistant sharps container. Transporting exposed sharps through the office increases risk. Sharps can injure staff and must not go into regular trash. Two-handed recapping increases needle stick risk. Question 21. When a patient encounter unfolds in a busy front office, the prefix hypo appears in a term such as hypoglycemia. Which meaning is correct? Option A, below normal or deficient. Option B, against. Option C, before. Option D, above normal. The correct answer is option A, below normal or deficient. Hypo means below normal or deficient, as in low blood glucose. Against is indicated by anti. Before is indicated by pre. Above normal is indicated by hyper. Question 22. Given the workflow in an infection control audit, blood flow stops during a venipuncture after the tube begins filling. Which action is most appropriate? Option A, remove the tourniquet and continue filling all tubes. Option B, probe aggressively until blood returns. Option C, gently adjust the needle position while maintaining safety. Option D, label the empty tube as collected. The correct answer is option C, gently adjust the needle position while maintaining safety. A small adjustment may restore blood flow if the bevel is against the vein wall. Without blood flow, the collection cannot continue effectively. Excessive probing can injure tissue and increase patient discomfort. A tube without the required specimen must not be labeled as completed. Question 23. At the start of care in a quality control review, the suffix ectomy appears in a procedure term. Which meaning is most accurate? Option A, inflammation. Option B, abnormal softening. Option C, visual examination. Option D, surgical removal. The correct answer is option D, surgical removal. Ectomy means surgical removal of a structure. Inflammation is indicated by itis. Abnormal softening is indicated by malacia. Visual examination is often indicated by scopy. Question 24. After reviewing the situation in an internal medicine office, the assistant identifies an abnormal rhythm on a tracing after it prints. Which action is within the medical assistant role? Option A, change the tracing to make it look normal. Option B, diagnose the rhythm for the patient. Option C, discard the tracing to avoid alarming the patient. Option D, give the tracing to the provider promptly according to protocol. The correct answer is option D, give the tracing to the provider promptly according to protocol. The assistant may recognize urgency and route the tracing, but interpretation belongs to qualified clinicians. Altering medical records is unethical and unsafe. Medical assistants should not provide a cardiac diagnosis. Abnormal results must not be hidden or discarded. Question 25. For a patient encounter in a telephone triage workflow, the assistant uses a fire extinguisher on a small contained fire. Which acronym describes extinguisher use? Option A, RICE. Option B, PERLA. Option C, HIPAA. Option D, PASS. The correct answer is option D, PASS. PASS stands for pull, aim, squeeze, and sweep. RICE refers to rest, ice, compression, and elevation for certain injuries. PERLA describes pupil assessment. HIPAA governs health information privacy and security. Question 26. During a medication administration visit, a patient is left without follow-up after the provider terminates care without proper notice. Which legal issue is most likely? Option A, beneficence. Option B, default. Option C, coinsurance. Option D, abandonment. The correct answer is option D, abandonment. Abandonment occurs when care is ended without proper notice or an opportunity to obtain continuing care. Beneficence means acting for the patient's good. Assault is a threat or fear of unwanted touching, not failure to provide follow-up. Coinsurance is a payment-sharing insurance term. Question 27. While working in a treatment room, a patient requests an appointment reminder by text message. Which consideration is important? Option A, text any diagnosis to any phone number in the chart. Option B, post the reminder on social media. Option C, follow office policy and patient communication preferences. Option D, ignore all reminder preferences. The correct answer is option C, follow office policy and patient communication preferences. Electronic reminders should follow privacy policy and documented preferences. Sensitive information and wrong numbers can create privacy risk. Public posting would expose private information. Preferences help guide appropriate communication. Question 28. An office review in a certification exam scenario shows that soap and water are required instead of alcohol sanitizer after caring for a patient with suspected Clostridioides difficile. Which reason explains this requirement? Option A. Soap and water help remove spores more effectively from the hands. Option B. Gloves completely replace hand hygiene. Option C. Alcohol sanitizer is always illegal in clinics. Option D. Hand washing is needed only before eating. The correct answer is option A. Soap and water help remove spores more effectively from the hands. Certain spores are not reliably eliminated by alcohol-based hand rubs, so mechanical washing is important. Gloves reduce exposure but do not replace hand hygiene after removal. Alcohol-based hand rubs are appropriate for many routine situations. Hand hygiene is required at multiple points in patient care. Question 29. A medical assistant is working in an infection control audit when the P wave is reviewed on an electrocardiogram. Which event does it represent? Option A. Atrial depolarization. Option B. Ventricular repolarization. Option C. Ventricular depolarization. Option D. Kidney filtration. The correct answer is option A. Atrial depolarization. The P wave represents electrical activation of the atria. Ventricular repolarization is represented by the T wave. Ventricular depolarization is represented mainly by the QRS complex. Kidney filtration is unrelated to electrocardiogram waveforms. Question 30. The care team in a medical office workflow asks for guidance because a patient calls with chest pain and shortness of breath. Which scheduling action is most appropriate? Option A. Follow emergency triage protocol immediately. Option B. Give a diagnosis over the phone. Option C. Tell the patient to send an email later. Option D. Schedule the patient for next month. The correct answer is option A. Follow emergency triage protocol immediately. Potential emergency symptoms should be handled urgently according to office protocol rather than scheduled as routine. Medical assistants should not diagnose the cause of symptoms. Potential emergencies require immediate action. Routine scheduling can delay care for potentially serious symptoms. Question 31. Before the visit continues in a pediatric clinic, a patient says they cannot afford a prescribed medication. Which response is best? Option A. Tell the patient to stop all medications. Option B. Notify the provider or appropriate staff so alternatives can be discussed. Option C. Suggest sharing medication with a friend. Option D. Ignore the comment because finances are private. The correct answer is option B. Notify the provider or appropriate staff so alternatives can be discussed. Cost concerns affect adherence and should be routed to the care team for appropriate options. Stopping medication without provider guidance can be unsafe. Sharing prescriptions is unsafe and inappropriate. The concern directly affects care and should be addressed respectfully. Question 32. To protect safety in a medication administration visit, the provider discusses gas exchange in the lungs. Which structure is primarily responsible? Option A. Ureters. Option B. Alveoli. Option C. Villi. Option D. Tendons. The correct answer is option B. Alveoli. Alveoli are tiny air sacs where oxygen and carbon dioxide are exchanged. Ureters carry urine from the kidneys to the bladder. Villi increase absorption in the small intestine. Tendons connect muscle to bone. Question 33. A medical assistant is working in a quality control review when a patient pays a fixed amount at the time of an office visit. Which insurance term applies? Option A. Copayment. Option B. Adjustment. Option C. Deductible. Option D. Premium. The correct answer is option A. Copayment. A copayment is a fixed amount the patient pays for a covered service. An adjustment changes the billed amount based on contracts or corrections. A deductible is the amount the patient pays before insurance begins paying according to the plan. A premium is the amount paid to maintain insurance coverage. Question 34. The care team in an outpatient laboratory asks for guidance because a patient collapses in the hallway and is unresponsive. Which action should be taken first? Option A. Finish documenting the previous visit. Option B. Move the patient to a chair before assessing. Option C. Offer water by mouth immediately. Option D. Activate emergency response and assess breathing according to training. The correct answer is option D. Activate emergency response and assess breathing according to training. An unresponsive patient requires immediate emergency response and basic life support actions within training. Documentation should not delay emergency care. Unnecessary movement can cause injury and delay assessment. Giving oral fluids to an unresponsive patient risks aspiration. Question 35. Following office protocol in an infection control audit, a chemistry panel requiring plasma is ordered and the facility uses heparin tubes. Which tube color is commonly associated? Option A, green tube. Option B, lavender tube. Option C, gray tube. Option D, light blue tube. The correct answer is option A, green tube. Green tubes commonly contain heparin and are used for certain plasma chemistry tests. Lavender EDTA is typically used for hematology testing. Gray tubes are often used for glucose-related testing depending on protocol. Light blue citrate is used for coagulation testing. Question 36. At the start of care in a primary care office, a medical assistant is preparing a sterile field. Which action would contaminate the field? Option A, using sterile forceps for sterile supplies. Option B, reaching across the sterile field with an unsterile sleeve. Option C, opening the wrapper away from the body first. Option D, keeping sterile items above waist level. The correct answer is option B, reaching across the sterile field with an unsterile sleeve. Crossing a sterile field with unsterile clothing can contaminate the field. Sterile forceps can help maintain asepsis when used correctly. Opening the far flap first is a common way to avoid reaching over the field. Sterile items are generally kept in view and above waist level. Question 37. An office review in an infection control audit shows that the provider requests an adult radial pulse during intake. Which technique should the medical assistant use? Option A, use the thumb to feel the pulse. Option B, place 2 or 3 fingers over the radial artery at the wrist. Option C, place the stethoscope over the abdomen. Option D, count respirations before locating the pulse. The correct answer is option B, place 2 or 3 fingers over the radial artery at the wrist. The radial artery at the thumb side of the wrist is commonly used for an adult pulse. The thumb has its own pulse and can interfere with accurate counting. The abdomen is not used for a routine radial pulse. Respirations are measured separately and do not identify the pulse site. Question 38. During a busy front office, a patient has an irregular pulse during routine vital signs. Which measurement method is most appropriate? Option A, count the pulse for a full 60 seconds. Option B, use the patient's previous pulse from the chart. Option C, skip the pulse and record not available. Option D, count for 10 seconds and multiply by 6. The correct answer is option A, count the pulse for a full 60 seconds. An irregular rhythm requires a full minute count to improve accuracy. Old values do not represent the current clinical status. The findings should be measured and reported rather than skipped. Short counts are less reliable when the rhythm is irregular. Question 39. Given the workflow in a primary care office, the urinary system is reviewed with a student. Which organ filters blood to form urine? Option A, spleen. Option B, appendix. Option C, kidney. Option D, gallbladder. The correct answer is option C, kidney. The kidneys filter blood, regulate fluid balance, and form urine. The spleen filters blood cells and supports immune function but does not form urine. The appendix is associated with lymphoid tissue in the digestive tract. The gallbladder stores bile and does not form urine. Question 40. A medical assistant is working in a quality control review when lead V1 is being placed for a standard 12-lead electrocardiogram. Which location is correct? Option A, fourth intercostal space at the right sternal border. Option B, fourth intercostal space at the left sternal border. Option C, left arm below the clavicle. Option D, fifth intercostal space at the left midclavicular line. The correct answer is option A, fourth intercostal space at the right sternal border. V1 belongs at the fourth intercostal space on the right side of the sternum. That location corresponds to V2. The left arm electrode is a limb lead site, not V1. That location corresponds to V4 in standard placement. Question 41. While working in a diagnostic testing area, a wet floor is noticed near the reception desk. Which action best prevents injury? Option A, ignore it because it is not in an exam room. Option B, place a warning sign and arrange cleanup immediately. Option C, wait until a patient reports slipping. Option D, cover it with loose papers. The correct answer is option B. Place a warning sign and arrange cleanup immediately. Prompt warning and cleanup reduce slip and fall risk. Safety hazards matter throughout the facility. Prevention should occur before an injury happens. Loose paper can worsen slipping and does not clean the hazard. Question 42. Following office protocol in an outpatient laboratory, the assistant reviews the path of blood leaving the right ventricle. Which vessel receives it? Option A, aorta. Option B, pulmonary vein. Option C, pulmonary artery. Option D, superior vena cava. The correct answer is option C, pulmonary artery. The pulmonary artery carries deoxygenated blood from the right ventricle to the lungs. The aorta carries oxygenated blood from the left ventricle to the body. Pulmonary veins return oxygenated blood from the lungs to the left atrium. The superior vena cava returns venous blood to the right atrium. Question 43. The care team in a family practice clinic asks for guidance because a provider orders a medication using an abbreviation on the unsafe abbreviation list. Which action should the medical assistant take? Option A. Ask another patient what the abbreviation means. Option B. Ignore the medication order completely without communication. Option C. Clarify the order before proceeding. Option D. Interpret the abbreviation however it seems most likely. The correct answer is option C. Clarify the order before proceeding. Unsafe or unclear medication orders must be clarified to prevent misinterpretation. Patients are not appropriate sources for interpreting orders. The order should be clarified rather than silently ignored. Guessing can lead to serious medication errors. Question 44. A medical assistant is working in a cardiology practice when the patient asks why they must lie still during an electrocardiogram. Which explanation is best? Option A. Movement can create artifact that makes the tracing harder to interpret. Option B. Movement changes the patient's blood type. Option C. Electrodes are used only to deliver medication. Option D. The machine cannot record any heartbeat unless the patient holds breath for 5 minutes. The correct answer is option A. Movement can create artifact that makes the tracing harder to interpret. Stillness improves the quality of the electrical recording. Movement has no effect on blood type. Electrodes detect electrical activity and do not deliver medication during a standard recording. Normal breathing is usually allowed, but excessive movement should be avoided. Question 45. As part of exam preparation in a quality control review, the medical assistant is measuring respirations after counting the pulse. Which technique helps obtain the most accurate result? Option A. Ask the patient to breathe as deeply as possible. Option B. Record the respiratory rate from the last visit. Option C. Count for 5 seconds and multiply by 12. Option D. Count respirations while the patient is unaware of the measurement. The correct answer is option D. Count respirations while the patient is unaware of the measurement. Patients may change breathing patterns if they know respirations are being counted. Deep breathing changes the normal respiratory rate and effort. Current respirations must be measured during the encounter. Very short counts are often inaccurate for respirations. Question 46. Following office protocol in a diagnostic testing area, the provider mentions the largest artery in the body. Which vessel is being described? Option A. Aorta. Option B. Pulmonary vein. Option C. Carotid vein. Option D. Vena cava. The correct answer is option A. Aorta. The aorta is the main artery carrying blood from the left ventricle to systemic circulation. Pulmonary veins return blood from the lungs to the heart. Carotid structures are in the neck, but the carotid artery is not the largest artery. The vena cava is a large vein returning blood to the heart. Question 47. When a patient encounter unfolds in a medical office workflow, the provider asks for an instrument to examine the ear canal. Which instrument should be prepared? Option A. Speculum for pelvic exam. Option B. Spirometer. Option C. Ophthalmoscope. Option D. Otoscope. The correct answer is option D. Otoscope. An otoscope is used to inspect the ear canal and tympanic membrane. A vaginal speculum is not used to inspect the ear canal. A spirometer evaluates lung function rather than the ear. An ophthalmoscope is used to examine internal eye structures. Question 48. As part of exam preparation in a busy front office, the term bradycardia appears in the chart. Which meaning should the medical assistant recognize? Option A, high blood sugar. Option B, slow heart rate. Option C, inflammation of the liver. Option D, fast breathing. The correct answer is option B, slow heart rate. The prefix brady means slow, and cardia refers to the heart. High blood sugar is hyperglycemia. Inflammation of the liver is hepatitis. Fast breathing is tachypnea rather than bradycardia. Question 49. The care team in a telephone triage workflow asks for guidance because a patient has been drinking hot coffee immediately before an oral temperature. Which action should the medical assistant take? Option A, switch to a rectal temperature without asking. Option B, take the temperature immediately because oral readings are unaffected. Option C, record the temperature as normal without measuring it. Option D, await according to office protocol before measuring the oral temperature. The correct answer is option D, wait according to office protocol before measuring the oral temperature. Hot or cold intake can temporarily alter oral temperature and lead to an inaccurate reading. Changing to an invasive route requires proper indication and protocol. Recent liquids can affect oral temperature results. Vital signs must be measured rather than assumed. Question 50. At the start of care in an outpatient laboratory, an electronic record uses an audit trail. What is its purpose? Option A, track who accessed or changed information. Option B, measure blood pressure. Option C, approve insurance claims instantly. Option D, sterilize instruments automatically. The correct answer is option A, track who accessed or changed information. Audit trails support accountability by recording user activity in the record. Vital sign measurement requires clinical equipment and technique. Payer claims processing is separate from record audit logs. Audit trails do not process instruments. Question 51. An office review in a certification exam scenario shows that an order reads amoxicillin 500 mg by mouth. Which abbreviation matches the route? Option A, PA. Option B, subcut. Option C, 4. Option D, IM. The correct answer is option A, PA. PA means by mouth and is used for oral administration. Subcut means subcutaneous and refers to injection into tissue under the skin. 4 means intravenous and refers to administration into a vein. IM means intramuscular and refers to injection into muscle. Question 52. The care team in an administrative check-in area asks for guidance because the office schedules several patients at the start of each hour and sees them as rooms open. Which scheduling method is being used? Option A, wave scheduling. Option B, prior authorization. Option C, matrix blocking. Option D, stream scheduling. The correct answer is option A, wave scheduling. Wave scheduling brings patients in at set intervals such as the start of an hour. Prior authorization is payer approval and is not a scheduling method. Matrix blocking reserves time unavailable for patient appointments. Stream scheduling assigns patients specific individual appointment times. Question 53. In a patient intake station, the provider asks for body mass index during an adult wellness visit. Which values are needed? Option A, height and weight. Option B, blood pressure and temperature. Option C, pulse and respirations. Option D, oxygen saturation and pain score. The correct answer is option A, height and weight. Body mass index is calculated from height and weight. Blood pressure and temperature do not determine body mass index. Pulse and respirations are vital signs but are not used to calculate body mass index. Oxygen saturation and pain score provide different clinical information. Question 54. Following office protocol in an exam room, the assistant prepares a vaccine that must remain refrigerated. Which practice is safest? Option A, place it in direct sunlight to warm quickly. Option B, use it after expiration if it looks clear. Option C, store it in a desk drawer overnight. Option D, maintain required temperature storage and check expiration before use. The correct answer is option D, maintain required temperature storage and check expiration before use. Vaccines and temperature-sensitive medications require proper storage to preserve effectiveness. Sunlight and heat can damage the product. Appearance does not prove potency after expiration. Room temperature storage can damage refrigerated products. Question 55. To protect safety in a preventive care visit, the abbreviation NPO appears before a procedure. Which instruction does it represent? Option A, normal pulse output. Option B, nasal passage open. Option C, new patient only. Option D, nothing by mouth. The correct answer is option D, nothing by mouth. NPO means the patient should take nothing by mouth for the specified period. NPO does not describe pulse measurement. NPO is not a nasal assessment abbreviation. New patient only is not the meaning of NPO. Question 56. To protect safety in an outpatient laboratory, a patient asks why a medication is placed under the tongue. Which route is being described? Option A, sublingual. Option B, topical. Option C, ophthalmic. Option D, otic. The correct answer is option A, sublingual. Sublingual administration places medication under the tongue for absorption through oral mucosa. Topical medications are applied to the skin or surface tissues. Ophthalmic medications are used in the eye. Otic medications are placed in the ear. Question 57. When a patient encounter unfolds in a specialty referral visit, the abbreviation PRN appears on a medication list. Which meaning should be recognized? Option A, as needed. Option B, every morning. Option C, by mouth. Option D, immediately. The correct answer is option A, as needed. PRN means the medication is taken as needed according to the order. Every morning is commonly abbreviated differently and is not PRN. By mouth is PA. Immediately is STAT in common medical usage. Question 58. An office review in a patient intake station shows that a laboratory result is critical and the protocol requires immediate notification. Which action should the assistant take? Option A, tell the patient the exact diagnosis without provider review. Option B, discard the result because it is abnormal. Option C, file the result for review at the end of the month. Option D, notify the provider or designated clinical staff promptly. The correct answer is option D, notify the provider or designated clinical staff promptly. Critical results require rapid communication so the care team can respond. Diagnosis and interpretation belong to the provider. Abnormal results must be reported, not discarded. Delaying a critical result can put the patient at risk. Question 59. While working in a preventive care visit, a child needs a height and weight recorded for medication dosing. Which documentation practice is safest? Option A, use the parent's estimate if the scale is nearby. Option B, record the measurements using the unit required by the office protocol. Option C, round weight to the nearest 10 pounds. Option D, record height only because weight changes often. The correct answer is option B, record the measurements using the unit required by the office protocol. Accurate units are essential because dosing and growth assessment can depend on precise measurements. Estimated weight is less reliable than a measured value. Large rounding errors can create unsafe dose calculations. Both height and weight may be needed for clinical assessment. Question 60. As part of exam preparation in a diagnostic testing area, a patient makes a complaint about care received in the office. Which response is most professional? Option A, post the complaint online for staff opinions. Option B, listen respectfully and follow the office complaint process. Option C, argue until the patient stops complaining. Option D, delete documentation related to the complaint. The correct answer is option B, listen respectfully and follow the office complaint process. A respectful response and proper reporting support patient relations and quality improvement. Publicly sharing patient concerns can violate confidentiality. Arguing escalates conflict and is unprofessional. Destroying or altering records is unethical and may be illegal. Question 61. Before the visit continues in a certification exam scenario, an assistant is unsure how to handle a chemical disinfectant spill. Which resource should be consulted? Option A, safety data sheet. Option B, appointment reminder template. Option C, patient intake form. Option D, insurance remittance advice. The correct answer is option A, safety data sheet. The safety data sheet gives hazard, handling, storage, and spill response information for chemicals. Reminder templates do not address workplace chemical safety. An intake form does not provide chemical safety instructions. Remittance advice explains payment decisions, not chemical hazards. Question 62. At the start of care in a medical office workflow, a 12-lead electrocardiogram shows wandering baseline artifact. Which cause is most likely? Option A, A properly grounded machine with still patient. Option B. A normal calibration mark only. Option C. Poor electrode contact or patient movement. Option D. Correct limb lead placement. The correct answer is option C. Poor electrode contact or patient movement. Wandering baseline is commonly caused by motion, loose electrodes, or poor skin contact. Good grounding and stillness reduce electrical or motion artifact. Calibration marks do not explain baseline movement during tracing. Correct placement should reduce rather than create artifact. Question 63. Before the visit continues in an infection control audit, the term nephrology appears in a referral. Which specialty is involved? Option A. Eyes. Option B. Bones. Option C. Kidneys. Option D. Ears. The correct answer is option C. Kidneys. Nephrology is the specialty focused on kidney function and disease. Ophthalmology focuses on eyes. Orthopedics focuses on the musculoskeletal system. Otolaryngology focuses on ear, nose, and throat conditions. Question 64. An office review in a pediatric clinic shows that a patient with known latex allergy is scheduled for a procedure. Which preparation is best? Option A. Use latex-free supplies and clearly communicate the allergy. Option B. Ignore the allergy if the procedure is short. Option C. Use powdered latex gloves because they are easier to put on. Option D. Tell the patient to bring personal gloves only. The correct answer is option A. Use latex-free supplies and clearly communicate the allergy. Avoiding latex exposure prevents allergic reactions and keeps the team aware of the risk. Even brief latex exposure can cause a serious reaction. Latex gloves can trigger a reaction in a latex allergic patient. The clinic remains responsible for preparing a safe care environment. Question 65. During an infection control audit, the assistant reinforces instructions for a Holter monitor. Which point is important? Option A. Submerge the monitor in water. Option B. Keep a diary of symptoms and activities as instructed. Option C. Ignore the return time. Option D. Remove electrodes whenever symptoms occur. The correct answer is option B. Keep a diary of symptoms and activities as instructed. A symptom and activity diary helps correlate events with the recorded rhythm. Water can damage the device and create safety risks. The monitor must be returned as scheduled for data review. Removing electrodes can interrupt recording when data are most important. Question 66. In a certification exam scenario, a patient asks the medical assistant to interpret laboratory results. Which response is within scope? Option A. Diagnose the patient based on abnormal values. Option B. Post the result publicly so others can comment. Option C. Change the results so it appears normal. Option D. Tell the patient the provider will review and explain the results. The correct answer is option D. Tell the patient the provider will review and explain the results. Interpreting results and giving diagnostic meaning are provider responsibilities. Diagnosis is outside the medical assistant scope of practice. Public disclosure violates confidentiality and professionalism. Changing results is unethical and falsifies the record. Question 67. Following office protocol in a walk-in clinic, a patient receives a document explaining what the insurer paid and what may be owed. Which document is this? Option A. Explanation of benefits. Option B. Progress note. Option C. Sterilization log. Option D. Advance directive. The correct answer is option A. Explanation of benefits. An explanation of benefits summarizes payer processing, allowed amounts, payments, and patient responsibility. A progress note documents clinical care, not insurance payment decisions. A sterilization log tracks instrument processing, not claim payment. An advance directive communicates future care wishes, not payment information. Question 68. A medical assistant is working in an internal medicine office when an adult patient declines a procedure after the provider explains the risks and benefits. Which principle is being respected? Option A. Patient autonomy. Option B. Abandonment. Option C. Respondeat superior. Option D. Beneficence. The correct answer is option A. Patient autonomy. Autonomy means a competent patient has the right to make informed decisions about care. Abandonment involves ending care without proper notice or support. Respondeat superior concerns employer responsibility for employee actions. Beneficence means acting for the patient's good but does not override a competent refusal. Question 69. A medical assistant is working in a patient education session when a new patient completes a health history form with several medication allergies listed. Which action should the medical assistant take next? Option A. Place the form in the chart without reviewing it. Option B. Remove allergies that the patient says happened many years ago. Option C. Verify the allergy information and enter it clearly in the medical record. Option D. Ask the patient to remember only prescription allergies. The correct answer is option C. Verify the allergy information and enter it clearly in the medical record. Medication allergies must be confirmed and documented so the care team can avoid unsafe orders. Important safety information can be missed if the history is not reviewed. Past reactions may still be clinically important and should not be deleted without provider direction. Allergies to over-the-counter drugs, foods, or latex may also affect care. Question 70. A medical assistant is working in a family practice clinic when a pregnancy test performed in the office is classified as waived testing. Which requirement still applies? Option A. Skip controls because waived means unregulated. Option B. Follow manufacturer instructions and quality control policy. Option C. Report results before the test develops. Option D. Use expired kits if the package is unopened. The correct answer is option B. Follow manufacturer instructions and quality control policy. Waived tests are simple, but they still require correct procedure, controls, and documentation. Waived status does not eliminate quality responsibilities. Reading before the correct time can produce inaccurate results. Expired test kits may give unreliable results. Question 71. As part of exam preparation in a community health clinic, a patient asks the assistant whether to stop taking a prescribed medication. Which response is appropriate? Option A. Suggest using a friend's medication. Option B. Recommend doubling the dose instead. Option C. Refer the question to the provider. Option D. Tell the patient to stop immediately. The correct answer is option C. Refer the question to the provider. Medication changes require provider guidance because stopping therapy can be unsafe. Sharing medication is unsafe and inappropriate. Changing a dose without provider order is unsafe and outside scope. Directing medication discontinuation is outside the assistant role. Question 72. An office review in an outpatient laboratory shows that a patient arrives at check-in and the waiting room can overhear the conversation. Which practice protects privacy? Option A. Speak quietly and avoid announcing sensitive details. Option B. State the full diagnosis loudly to confirm the visit. Option C. Place all charts open on the counter. Option D. Ask other patients to help verify the record. The correct answer is option A. Speak quietly and avoid announcing sensitive details. Front office privacy requires limiting unnecessary disclosure where others may overhear. Announcing diagnoses in public can violate confidentiality. Open charts may expose protected information. Other patients should not be involved in private verification. Question 73. A medical assistant is working in a family practice clinic when lead V4 is being placed for a standard 12-lead electrocardiogram. Which location is correct? Option A. Midway between V2 and V4. Option B. Fourth intercostal space at the right sternal border. Option C. Fourth intercostal space at the left sternal border. Option D. Fifth intercostal space at the left midclavicular line. The correct answer is option D. Fifth intercostal space at the left midclavicular line. V4 is placed at the fifth intercostal space along the left midclavicular line. That location is used for V3 rather than V4. That location is used for V1. That location is used for V2. Question 74. To protect safety in an exam room, the term cardiology appears in a referral. Which specialty is involved? Option A. Skin disorders. Option B. Kidney disorders. Option C. Digestive disorders. Option D. Heart and cardiovascular system. The correct answer is option D. Heart and cardiovascular system. Cardiology focuses on the heart and cardiovascular system. Dermatology focuses on the skin. Nephrology focuses on the kidneys. Gastroenterology focuses on the digestive system. Question 75. Following office protocol in an internal medicine office, A package of sterile instruments has an expired sterilization date under office policy. Which action is appropriate? Option A, write a new date on the package. Option B, reprocess the instruments before use. Option C, open the package and rinse the instruments. Option D, use the instruments if the package is dry. The correct answer is option B, reprocess the instruments before use. Expired or compromised sterile items should not be used until they are properly reprocessed. Changing the date without reprocessing is unsafe and misleading. Rinsing does not restore sterility. A dry package alone does not override an expiration policy. Question 76. After reviewing the situation in a clinical skills review, a tickler file is used in the office. Which purpose does it serve? Option A, track future follow-ups or reminders. Option B, sterilize instruments. Option C, measure oxygen saturation. Option D, draw blood into tubes. The correct answer is option A, track future follow-ups or reminders. A tickler system helps staff remember time-sensitive tasks or future actions. Sterilization requires approved equipment and process. Oxygen saturation requires a pulse oximeter. Blood collection uses phlebotomy supplies, not a reminder file. Question 77. Given the workflow in a same-day appointment, a patient falls in the exam room. Which action is best? Option A, tell the patient to drive home without evaluation. Option B, hide the incident if no one saw it. Option C, pull the patient up immediately. Option D, call for help and assess for injury before moving the patient. The correct answer is option D, call for help and assess for injury before moving the patient. After a fall, unnecessary movement can worsen injury, so help and assessment come first. The patient should be assessed before leaving. Falls must be reported and documented according to policy. Moving the patient before assessment can worsen an injury. Question 78. When a patient encounter unfolds in an internal medicine office, a patient needs crutch walking education after provider instruction. Which principle is important? Option A, the patient should skip follow-up if pain increases. Option B, crutches should fit properly and not press into the axilla. Option C, crutches should be used only on wet floors. Option D, body weight should rest mainly on the armpits. The correct answer is option B, crutches should fit properly and not press into the axilla. Improper crutch fit can compress nerves and blood vessels in the axilla. Worsening symptoms should be reported according to instructions. Crutches are mobility aids and wet floors increase fall risk. Weight should be supported through the hands, not the axilla. Question 79. An office review in a certification exam scenario shows that the term dysuria is documented in the chief complaint. Which symptom does it describe? Option A, painful or difficult urination. Option B, ear inflammation. Option C, excessive thirst. Option D, difficulty swallowing. The correct answer is option A, painful or difficult urination. Dysuria refers to pain or difficulty with urination. Ear inflammation is otitis. Excessive thirst is polydipsia. Difficulty swallowing is dysphagia. Question 80. A medical assistant is working in a preventive care visit when a capillary puncture is needed on an adult finger. Which side is generally preferred? Option A, the side of the middle or ring finger pad. Option B, the center of the thumb pad. Option C, the tip of the index finger. Option D, the little finger near the bone. The correct answer is option A, the side of the middle or ring finger pad. The lateral side of the middle or ring finger pad helps avoid bone and sensitive central tissue. The thumb is often calloused and has a pulse, making it less preferred. The index finger is commonly used for touch and may be more sensitive or calloused. The little finger has less tissue over bone and is usually avoided. Question 81. Before the visit continues in a clinical skills review, a medication is labeled for otic use. Where should it be administered? Option A, ear. Option B, eye. Option C, nose. Option D, mouth. The correct answer is option A, ear. Otic medications are intended for the ear. Eye medications are ophthalmic, not otic. Nasal medications are administered through the nose. Oral medications are taken by mouth. Question 82. Following office protocol in a quality control review, the assistant must clean instruments before sterilization. Which concept explains this requirement? Option A, disinfection always destroys every spore. Option B, packaging instruments makes cleaning unnecessary. Option C, sterilization is the same as hand washing. Option D, organic material can interfere with sterilization. The correct answer is option D. Organic material can interfere with sterilization. Cleaning removes debris so the sterilization process can contact instrument surfaces effectively. Disinfection reduces many organisms but does not reliably destroy all spores. Packaging dirty instruments traps contamination rather than preparing them safely. Hand washing reduces microbes on skin but is not instrument sterilization. Question 83. At the start of care in a patient education session, a specimen must be protected from light after collection. Which handling method is appropriate? Option A, leave the specimen uncovered at the front desk. Option B, place the tube in direct sunlight to warm it. Option C, wrap the specimen in foil or use an amber container as directed. Option D, shake the specimen vigorously for 1 minute. The correct answer is option C. Wrap the specimen in foil or use an amber container as directed. Some analytes are light sensitive and require protection immediately after collection. Delayed or improper handling can compromise results. Sunlight can degrade light-sensitive specimens. Vigorous shaking can hemolyze blood specimens. Question 84. In a medication administration visit, a patient develops hives, wheezing, and swelling after an injection. Which action is most appropriate? Option A, schedule a routine follow-up for next week. Option B, notify the provider and activate emergency protocol immediately. Option C, ignore the symptoms if the injection site looks clean. Option D, tell the patient to drive home and rest. The correct answer is option B. Notify the provider and activate emergency protocol immediately. These findings can indicate anaphylaxis and require urgent response. Potential anaphylaxis cannot be delayed for routine follow-up. Systemic allergic symptoms matter even if the injection site appears normal. Respiratory symptoms and swelling require immediate attention. Question 85. For a patient encounter in a walk-in clinic, the term tachypnea appears on an intake form. Which meaning is correct? Option A, rapid breathing. Option B, slow pulse. Option C, low temperature. Option D, painful urination. The correct answer is option A, rapid breathing. Tachy means fast, and nea relates to breathing. Slow pulse is bradycardia. Low temperature is hypothermia. Painful urination is dysuria. Question 86. After reviewing the situation in a telephone triage workflow, the assistant is comparing two needle gauges. Which statement is accurate? Option A. A larger gauge number always means a longer needle. Option B. All injections use the same gauge. Option C. Gauge has no relation to needle size. Option D. A smaller gauge number indicates a larger needle diameter. The correct answer is option D. A smaller gauge number indicates a larger needle diameter. Needle gauge numbers are inverse to diameter, so lower numbers are wider. Gauge describes diameter, not length. Needle gauge varies by medication, route, and patient factors. Gauge specifically describes needle diameter. Question 87. In a diagnostic testing area, a manual blood pressure cuff is too small for the patient's arm. Which result is most likely? Option A. The blood pressure may read falsely high. Option B. The pulse oximetry reading will be inaccurate. Option C. The blood pressure may read falsely low. Option D. The temperature will be elevated. The correct answer is option A. The blood pressure may read falsely high. A cuff that is too small can overestimate blood pressure because pressure is applied over too narrow an area. Cuff size does not directly determine oxygen saturation accuracy. A cuff that is too large is more likely to produce a falsely low reading. Cuff size has no direct effect on body temperature. Question 88. During a quality control review, a student asks which blood component helps with clotting. Which answer is correct? Option A, alveoli. Option B, neurons. Option C, platelets. Option D, plasma glucose. The correct answer is option C, platelets. Platelets help form clots and support hemostasis. Alveoli are lung structures involved in gas exchange. Neurons transmit nerve signals and are not blood clotting cells. Glucose is a blood sugar and does not form clots. Question 89. During an exam room, a subcutaneous injection is ordered. Which site is commonly appropriate? Option A, deep into the deltoid muscle only. Option B, into an area that is bruised and inflamed. Option C, directly into a vein. Option D, abdomen with adequate subcutaneous tissue. The correct answer is option D, abdomen with adequate subcutaneous tissue. Subcutaneous injections are placed into fatty tissue, and the abdomen is a common site when appropriate. The deltoid muscle is an intramuscular site, not a routine subcutaneous site. Bruised or inflamed tissue should generally be avoided. Intravenous administration is a different route and is outside a subcutaneous injection. Question 90. Before the visit continues in an electronic health record review, a provider orders spirometry in the office. Which patient action is required? Option A, talk continuously during the maneuver. Option B, follow instructions for a strong, complete breathing maneuver. Option C, hold both nostrils and refuse to exhale. Option D, remove the mouthpiece before starting. The correct answer is option B, follow instructions for a strong, complete breathing maneuver. Spirometry requires patient effort and correct technique to produce useful results. Talking interferes with airflow measurement. The test depends on controlled breathing through the device. The mouthpiece is needed to measure airflow. Question 91. A medical assistant is working in a specialty referral visit when a sterile package is torn before a minor procedure. Which action is required? Option A, use the items if they look clean. Option B, tape the wrapper and use the contents. Option C, consider the contents contaminated and obtain a new sterile package. Option D, spray the package with disinfectant. The correct answer is option C, consider the contents contaminated and obtain a new sterile package. A torn wrapper breaks the sterile barrier, so the contents cannot be considered sterile. Clean appearance does not prove sterility. Taping does not restore sterility after the barrier is compromised. Surface disinfectant cannot sterilize items inside a compromised package. Question 92. At the start of care in an outpatient laboratory, a multi-dose vial has no date after being opened. Which action is most appropriate? Option A, follow facility policy and do not use it if safety cannot be verified. Option B, use it because the cap is still attached. Option C, guess the opening date from memory. Option D, mix it with another vial to avoid waste. The correct answer is option A, follow facility policy and do not use it if safety cannot be verified. Opened multi-dose vials require proper dating and storage to support medication safety. The cap does not prove when the vial was opened or whether it was stored correctly. Guessing creates unsafe documentation. Combining vials can contaminate medication and is not appropriate. Question 93. A medical assistant is working in an urgent care office when an adult patient has a blood pressure reading much higher than previous visits. Which action should the medical assistant take? Option A, erase the value because it may worry the patient. Option B, tell the patient that hypertension has been diagnosed. Option C, recheck using proper technique and report the finding according to protocol. Option D, send the patient home to rest without notifying anyone. The correct answer is option C, recheck using proper technique and report the finding according to protocol. Unexpected or significantly abnormal vital signs should be verified and communicated to the provider. Accurate documentation is required even when the value is abnormal. Medical assistants do not diagnose conditions based on one reading. Abnormal readings require appropriate follow-up rather than dismissal. Question 94. A medical assistant is working in an internal medicine office when an insurance plan requires approval before a specialist visit. Which process is being described? Option A, prior authorization or referral process. Option B, venipuncture. Option C, auscultation. Option D, autoclaving. The correct answer is option A, prior authorization or referral process. Some plans require authorization or referral before certain services are covered. Venipuncture is blood collection and does not authorize insurance coverage. Auscultation is listening to body sounds and does not approve visits. Autoclaving sterilizes instruments and is unrelated to payer approval. Question 95. In a procedure setup, a patient reports dizziness when standing and the provider requests orthostatic measurements. Which approach is most appropriate? Option A, measure blood pressure and pulse in different positions according to protocol. Option B, record the first seated blood pressure as orthostatic. Option C, measure only oxygen saturation while the patient is seated. Option D. Have the patient walk quickly before the measurement. The correct answer is option A. Measure blood pressure and pulse in different positions according to protocol. Orthostatic vital signs compare cardiovascular response to position changes. A single seated reading does not show positional change. Oxygen saturation does not assess the blood pressure and pulse changes requested. Exertion can distort the readings and increase fall risk. Question 96. Given the workflow in a diagnostic testing area, a patient is placed lying flat on the back for an abdominal exam. Which position is being used? Option A, supine. Option B, Fowler. Option C, Sims. Option D, a prone. The correct answer is option A, supine. Supine means lying on the back facing upward. Fowler position is seated or semi-seated. Sims position is side-lying with one knee flexed. Prone means lying face down. Question 97. To protect safety in a preventive care visit, the suffix itis appears in a medical term. Which meaning is most accurate? Option A, pain. Option B, removal. Option C, study of. Option D, inflammation. The correct answer is option D, inflammation. The suffix itis generally means inflammation. Pain is commonly indicated by the suffix algia. Removal is commonly indicated by the suffix ectomy. Study of is commonly indicated by the suffix logi. Question 98. An office review in a specialty referral visit shows that a patient asks which body system includes the skin. Which system should be identified? Option A, integumentary system. Option B, endocrine system. Option C, urinary system. Option D, respiratory system. The correct answer is option A, integumentary system. The integumentary system includes the skin, hair, nails, and related glands. The endocrine system is made of hormone-producing glands. The urinary system filters blood and eliminates urine. The respiratory system supports breathing and gas exchange. Question 99. To protect safety in a medical office workflow, a patient signs permission after the provider explains a procedure's risks, benefits, and alternatives. Which concept is demonstrated? Option A, implied consent. Option B, informed consent. Option C, battery. Option D, abandonment. The correct answer is option B, informed consent. Informed consent occurs when a patient agrees after receiving enough information to make a voluntary decision. Implied consent is inferred from actions such as extending an arm for a blood draw. Battery involves unauthorized touching or treatment. Abandonment involves ending care without appropriate notice. Question 100. At the start of care in a specialty referral visit, the bladder of a blood pressure cuff is not centered over the brachial artery. Which issue may occur? Option A. The pulse oximeter will stop working. Option B. The patient will automatically faint. Option C. The oral temperature will decrease. Option D. The reading may be inaccurate. The correct answer is option D. The reading may be inaccurate. Proper cuff placement over the brachial artery is needed for accurate auscultation. Blood pressure cuff alignment does not control the pulse oximeter. Incorrect cuff placement can be uncomfortable but does not automatically cause syncope. Cuff placement does not change oral temperature.